Comes the man.
Hello,
Here
Sean.
Hello. Hello, good evening, everybody. Welcome on this not so warm, sunny evening, but still the company is great and the company is warm. In fact, the company is hot, which is keeping us all good and dry over here. I'm glad everybody could make it. I am continuing my series that I started last week on cancer and what it is, what it isn't, and should we be afraid of it? Should we not be afraid of it? How do we handle it? So last week I covered a few of the basics as to exactly what is cancer, what is this thing catching or is it not? So please feel free to go back and look at the previous recordings. And tonight we'll continue on a little bit more. And I went over a couple of the tests and things that can be done last week to check and see, do you have this dread disease or not? And tonight we'll just continue on from there once again. Let's just get my PowerPoint going. Blame the rain for any issues over here. Right. Okay. So we're talking about cancer, the scary big C, the other big C, not the not so scary one anymore. So what causes cancer? We found out last week that it's not caused or that it's not catching. So if you know somebody who has cancer and they sneeze or cough around you, well, you can't catch it from them because it's not a virus. Cancer is it's an issue to do with your cells. And what happens is it's a normal cell that goes rogue, which is the description that I used last week for that. And it just needs a trigger. So technically speaking, we all have cancer cells in our body. All they need is a trigger to cause them to become cancer. Now, some of the things that can do it are certain chemicals, some viruses or bacteria. Radiation is obviously a big one. It can be hereditary, but the fact that maybe your mother had breast cancer or your father had prostate cancer doesn't necessarily mean that you will get it. It just means your risk is a bit higher. And as I always say to my patients when I speak to them, medical people are negative. Eagles are not negative, eagles are all positive, but medical people are always negative. So they always look for the worst case scenario. And we always plan for the worst case scenario. And we look at risks because everybody responds differently to life. Some people feel pain more easily than others. Some people never get sick. Some people do. They always tell you, don't smoke and drink because you're going to get cancer and die. Yet the recognized oldest woman in the world died at the age of 121. She was a French lady, and she had a cigarette and something to drink for pretty much 100 of those 121 years, if not more than that, I think. So who's to say? I had a brother-in-law that passed away from lung cancer a few years ago, who never smoked a cigarette in his life, lived up at Oraby, which is, if you know, the South Coast area is a farming area, and probably some of the freshest, cleanest smelling air that you can get, yet he developed lung cancer. So, what causes this? Diet is a big thing these days. It can lead to cancer, and also hormones. According to some population-based studies, and this information came from the National Cancer Institute. The regions with the highest incidence of different types of cancer in the UK is lung cancer, China, liver cancer, Japan, stomach cancer, Australia, skin cancer. And obviously that's because of all the sunshine that they have over there. And the US, colon cancer. Excuse me for 1 second. Canada, leukemia seems to be a big thing. And Brazil, cervical cancer. Why are these there? I don't really know. But this is just what they pick up through different studies that they've done over the years. So is the incidence of these cancers due to genes, behavior, or environmental risks? Colon cancer? Well, there you go. Japan, Japanese families in the US, much greater, and the US, significantly higher. So from that perspective, I can probably say that, yes, diet is related. Stomach cancer, on the other hand, there's a lot more in Japan than there is in the US. And Japanese families in the US are less than Japan, but more than the average of people in the US. So who really can tell? What increases your risk? And in a cigarette, I'm not going to go through all of these names, but just to give you an idea, these are just some of the carcinogenic chemicals found in tobacco smoke. So as Charlie always says, he wasn't a smoker, he was the sucker. The cigarette did the smoking, he was just the sucker. And unfortunately, we've got a lot of suckers out there. And sadly, we also have a lot of people who are not suckers, but get to inhale some of the secondhand smoke from these people. And you are as much at risk, if not more so, as a result of the secondary smoke. There's a 20-year lag time between smoking and lung cancer. And what I found when I was working in the oncology unit in Cape Town, we had to do various projects and things. And some of the research that I picked up over there was that lung cancer does not necessarily happen because you smoke. Quite often, other cancers happen because you smoke. Things like tongue, mouth, throat are all a lot more common in smokers than lung cancer. With the skin cancer, radiation, the ultraviolet radiation, is one of your leading causes. And this is why skin cancer is so prevalent in Australia. In areas with the least amount of sunshine, like Detroit and Pittsburgh, you have a lower incidence of skin cancer, whereas places like Dallas, which is in Texas, there's a lot more skin cancer over there because there's a lot more sunshine. And I guess you could extrapolate that to South Africa as well, because, okay, right now, obviously hasn't been a lot of sunshine the last 2 days, but generally South Africa has a lot more good sunshine days than other parts of the world. And obviously some areas are at greater risk because they have a lot more heat as well. So some viruses associated with human cancers, things like the Epstein-Barr virus, which leads to Burkitt's lymphoma, the human papillovirus, which leads to cervical cancer, and that human papillomavirus is commonly known as HPV, by the way. Hepatitis B can lead to liver cancer. Human T-cell lymphotrophic virus can lead to adult T-cell leukemia. Kaposi sarcoma is associated with the herpes virus, and this obviously it becomes Kaposi sarcoma. And I'll always remember when I was working in the oncology unit in Port Elizabeth many moons ago, the head radiographer came running through the one day and she said, "Oh, you have to come and see this patient. They've got this very rare thing. It's called Kaposi sarcoma." And that was the first time I ever got to see it and was exposed to it. And she said, "It's very, very rare and you won't see it very often. So you need to come and have a look at this patient," which I did. And now people who have HIV, Kaposi sarcoma is actually very common in them. So bacteria and stomach cancer, where's the relationship over there? They take a sample of the stomach through use of a scope. And the thing that leads to one of the causes of the stomach cancer is your H. pylori, and that H stands for Helicobacter. And this is also what leads to stomach ulcers. So it's very probable that if you ignore a stomach ulcer for too long, it can become stomach cancer. Breast cancer. Yeah, over here we can see out of all these different people, there's one that would be due to inherited factors, in other words, genetics, and all the others are due to other factors. So once again, as I said, medical people like to be negative. So it's not to say that you've got the genes for cancer to form, that you will get it, but your risk is slightly elevated. So what can people do to prevent cancer? And you need to try and protect yourself from these carcinogenic chemicals, radiation, and the cancer viruses or bacteria. My apologies for the red marks on my screen. I'm not too sure what that is, if it's just on my screen or if you're seeing it as well. But some of the things where you're going to be exposed more to chemicals that can cause cancer is things like arsenic, which you'll find in miners or mining and pesticide workers. And they can develop lung, skin, or liver cancers. Asbestos, you'll find in construction workers. Fortunately, these days, that risk is a lot lower because they have banned asbestos in construction. But that can lead to lung and mesothelioma cancers. Benzene, which you'll find in petrol and rubber and chemical workers, can lead to leukemia. Chromium, your metal workers and electroplaters are exposed to this and they can develop lung cancer. Leather dust found in shoe manufacturing, and from that perspective, myself in my job, because I often do shoe raisers and things, I'm also exposed to it, although I do take the precautions of obviously wearing a dust mask. But things like nasal and bladder cancer can develop there. Naphthalene, people who work in chemical, dye, and rubber industries can develop bladder cancer. Radon is found in underground mining, and again, lung cancer. Soot, tars, and oils from coal, gas, and petrol leads to lung, skin, and liver cancers. Vinyl chloride, these are rubber workers, polyvinyl or PVC manufacturing, leads to liver cancer. And you'll find this a lot in carpets as well, which is what that horrible smell is with a new carpet. And wood dust from furniture manufacturing can lead to nasal cancers. So is there a cancer epidemic? I often say, I don't know if we are just more aware of cancer these days, or is it actually becoming more prevalent? So some of the treatments, you get different types of treatment, and the first one is generally surgery, then obviously chemotherapy, radiation therapy, targeted therapy. immunotherapy, hypothermia or hyperthermia, which is heat, stem cell transplants, photodynamic therapy, lasers, blood product donation, and transfusion. So just to put this into perspective, obviously, if you've got this carcinoma or sarcoma or whatever, they're going to try and cut it out. And if they can find it where it's what they call differentiated and it's a clear little tumor, they can generally cut it out quite easily through surgery. Sometimes then the next thing is chemotherapy. So if they've discovered that the tumor is benign, which means it's not going to spread anywhere, and they can get the entire thing in one go, surgery will be the only treatment you need. If they find that it's slightly differentiated and it could possibly be spreading, which is like when they do breast biopsies, they will often take glands from underneath the arm, as I spoke about last week, to check. If in doubt, they will do the surgery and then they will do chemotherapy. Chemotherapy is nasty and it can take the form of either you go in weekly and have an intravenous drip given to you, or it can be oral chemotherapy. Chemotherapy is what our very own Dr. Arthur First was involved in before he came across to Neolife. Radiation therapy is what I used to, the department that I used to work in when I was in the oncology unit was radiation. And this is where the targeted therapy comes from as well. So in some cases, even today, if you've got prostate cancer, for instance, if it's small enough, they will take radioactive iodine seeds and surgically implant them into the tumor so that it can be treated from inside. And I won't get into all the technicalities, but it's quite an effective way of treating. Immunotherapy is just simply boosting your immune system. Hyperthermia essentially means burning it out. Stem cell transplant is pretty much self-explanatory, where they replace the stem cells in your bones with new bone marrow, basically. Photodynamic therapy is different types of laser or radiation therapy. Sun lamp is basically photodynamic. Lasers, you get cold and you get hot. Blood product donation and transfusion often happens with leukemia cases. Then we come in with where we fall under, which is complementary and alternative medicine. Things like dietary supplements. And Louis Smith is a very good example of that. Mind, body, and spirit counseling. Herbs, vitamins, and minerals. Now, it is a good idea to see people who are qualified in these things and who can guide you carefully. Palliative or supportive care. This is where my wife comes in hospice. And this focuses on helping patients get relief from symptoms caused by the serious illness. Things like nausea, pain, fatigue, or shortness of breath. And they will help you along the way with counseling, with oxygen, with pain medication. All those things go a long way to assisting in the palliative or the supportive care. So what are some of the side effects? We've all heard about the nasty side effects of these treatments, but what are they? Some of the physical side effects with chemotherapy and radiation, you have pain, nausea, and vomiting. There's extreme fatigue, anemia, lymphedema, where there's obviously swelling, and this I often see in people with breast cancer who have either had a mastectomy or breast radiation. Their arms tend to swell up quite badly with this lymphedema. And then we have to use compression stockings for that. Infection, because obviously your immune system is dropped. Fertility and sexual side effects. So there's various different issues over there. And also with chemotherapy, you tend to lose your hair with some forms, not all forms. Radiation, if you have radiation in one particular area on the head or on the body, the hair in that area will die off pretty much permanently. With chemotherapy, if your hair falls out, it will come back again afterwards. Some of the emotional side effects are distress, anxiety, fear and depression, coping with loss of a loved one. And as soon as you mention the fact that, oh, I've got cancer, people do tend to get very distressed. And when you get stressed or distressed, your immune system drops. And that is one of the worst things that can happen, because if your immune system is dropped, it leaves you open to more and more problems. So what are the costs of cancer? Cancer is an extremely expensive thing. The hidden costs are your health insurance premiums or your medical aid. And then the non-medical expenses. We all know how much, or we've got an idea about the cost of radiation and chemotherapy. I can't give you exact cost, but R1 million is a pretty average bill for people on chemotherapy and radiation. Your non-medical expenses, your transportation to and from the treatment areas, the child or elder care. So if there's children, what do you do with them? Because if you're having radiation, for instance, that's usually 5 days a week. If you're down here on the South Coast, that either requires you to travel through daily from the South Coast to Durban, or you travel through and you have to look for accommodation over there. So it becomes expensive. If you can't look after yourself, you need to have assistance at home. Then if your hair falls out, you need wigs. All of those things cost money. Cancer has the most devastating economic impact of any cause of death in the world because it drags out for so long. We've seen it just recently with my mother. She was diagnosed originally with a little spot on her nose. I can't even remember how many years ago that was. But obviously now in the last year or so, it became worse and worse and worse. I remember with my late brother-in-law, he had a particularly aggressive type of lung cancer. And it was almost exactly 6 months from the date, 12 months from the date of diagnosis to the date of him passing away. And for 6 of those 12 months, he was in hospital. And if anybody's been in hospital, I think you understand the costs of a hospital, because it's usually in the region of about 2,500 Rand per day in a ward like a surgical ward or a medical ward. If you're in ICU or higher care, those costs just quadruple. The worldwide economic costs of cancer are somewhere in the region of about $895 billion US. That is an inconceivable amount for me. I can't even wrap my mind around it. Cancer costs the United States an estimated $263.8 billion in medical costs and lost productivity in 2010. Imagine 13 years later. With the growth and aging of the population, prevention efforts are important to help reduce new cancer cases, human suffering, and economic costs. And this is called information gathered from the Global Cancer Facts and Figures. The costs of direct medical care for cancer are estimated to account for 5% of national healthcare spending. United Healthcare estimated that 11% of its costs are for cancer care. National expenditures for cancer care in 2004, $72 billion. In 2010, $125 billion, estimated to increase to $158 billion in 2020. I don't know what the actual figures are. The American Cancer Association wants to expand public coverage by removing the Medicaid eligibility categories and raising the income threshold. They also want to allow all non-elderly, non-disabled citizens and legal US residents with family incomes below 133% of the federal poverty level or about $30,000 per year for a family of 4, to be eligible for Medicaid benefits. And they want to extend coverage to low-income, childless adults, providing them with access to preventative care, such as colon and breast cancer screenings. They anticipate that more people with cancer can be diagnosed and treated at an earlier stage, thus increasing their chance for survival. Because remember, the earlier you can detect cancer, the better your chance of recovery. And I'm going to stop there because we've got about 7 minutes left, but I'd like to give time for any questions or comments at this stage. If not, I will stop recording and then we'll have an open mic.